Let me share some of these horrible stories. The Vice President started highlighting autism. Let's get into the details of what's really going on in Minnesota. These are real cases from our group at CMS. These are adjudicated numbers. There's a fraud scheme in Minnesota where criminals, soon-to-be criminals, pay moms $1,000 roughly in order to enroll their children as being autistic, falsely, dishonestly claiming their children are autistic. They then bill Medicaid, this has already happened, millions of dollars for services that were never rendered, never delivered by a qualified staff member. These schemes disproportionately involve immigrant communities. They're insulated, they're able to organize efforts, and sometimes they don't understand what's going on. And it ultimately diverts resources away from kids who truly have autism. Because if every kid in the neighborhood has autism, then nobody has autism in terms of how you can manage them. There was one behavioral, and by the way, these kids, they carry that diagnosis of autism the rest of their lives. Their mom made a bad decision, the kid pays the price for the rest of their life. There's one behavioral health organization, Mr. Vice President, in Minnesota. They received $11.5 million in Medicaid payments, but the top biller submitted 450 days where they claimed they were working more than 24 hours a day. I mean, even in the White House, that's tough. It's hard to work more than 24 hours a day. How it didn't get picked up is shocking to us at CMS. There are other red flags in Minnesota, including hundreds of beneficiaries receiving treatment linked to one location, which was impossible physically to be true. We had 8 beneficiaries in one of these substance use disorder centers, 8 who were already dead, but the center was still billing us. Not only did they let the person pass, they kept billing for it. That's the level of average we're talking